Thank you for opening up the Congress to France. I think Biba and Decio and Zakaria have summed up perfectly all the different issues that I've put on the PowerPoint and how we can go about having a more constructive way of accompanying from the very beginning. I think Biba and Zakaria did from the very beginning, from the first days of life, that it's important that there's a double support, psychological and medical and social. First slide. From the first days of life, that it's important that there's a double support, psychological and medical and social. First slide. So the role of the psychologist in sickle cell care, it's been said, it should be routine, not stigmatized from the very beginning, that the family, the children meet together and can put into words. I think Zakaria said how important it is to be able to speak about it. And when the healthcare is just the medical part, there's a big lack of being able to put into words everything that Biba and Decio and Zakaria have said. The next slide. So sickle cell disease, say it's positive and negative, it's invisible to others. So it can be hidden and not spoken about because it doesn't show. And from the very beginning, the baby is completely normal and the parents are expecting a normal baby. Next slide. And what all the testimonials have said is how, certainly Biba, that the symptoms and manifestations come from the very first months of life. It's variable. It can be 6 months, 9 months, even earlier. And that it's unpredictable is extremely difficult for the parents and for the children. And Biba gave all the symptoms: fatigue, back pains, hand swelling, joint pains, fatigue, anemia, headaches, fever. There's multiple symptoms, and parents with a newborn baby have to cope with the symptoms and the unpredictability of not being able to know when there's going to be a crisis, when their child is going to have a painful crisis. Next slide. Well, sickle cell is a complex disease. It's very hard to deal with and to think about for the parents. For many of the parents, especially in France, when they have put together that sickle cell disease, or the word in French, drépanocytose, which is impossible to pronounce, means a disease that they know in their mother countries, immediately they think of early death. And this early death weighs on the family, on the children, and is not often brought into the pediatric consultation to be expressed. It's a phantom that is in the consultation, and it's important to be able to speak about this from the first consultation when the baby's there, because with modern healthcare in most countries, access is difficult, but it does not mean early death. In Europe, it does not mean early death. And the symbolic significance that it's an inherited disease and it's a blood disease, and all this needs to be spoken about, because there's the unspoken is what weighs on the baby, weighs on the young child, weighs on the teenager, and then adult. And there's this implicit need for psychological support, but a light support, the putting into words. And as it was very clearly said, this is often not available. There's reticence to consult a psychologist. There's no financing, and it's ignored in public health programs because it's too expensive. Next slide. In all pediatric health plan, a psychologist is important, and it all begins when the disease is announced to the parents. And it is very rare that this announcement is in the presence of an accompanying psychologist, not because the parents need the psychologist when it's announced, but the pediatrician too, to see how the baby and how the parents are going to react to hearing that their baby has a disease that they didn't expect. And this psychologist there can put into words the different fears, the taboos, and then reduce by putting into words the psychological effects on sickle cell disease. And as the testimonial said, the parents feel guilty, they feel sad, they are ashamed, they feel very lonely, and they're very afraid that their baby may die before he's 5 years old. And the baby in the consultation is extremely sensitive to his parents' reactions. He knows something's happening, but he doesn't understand why. And so from the very first days, as Akahaya said, the baby feels that there's something's happened, something dramatic has happened with his life that up until the announcement was unknown to him. And so this accompaniment can liberate the thought processes, and when needed can facilitate a referral for some specialized care, but this is exceptional if there's an accompaniment from the beginning. It's not psychological help that needs to be put into place, but an accompaniment to put into words all these different issues. Next slide. Well, the most crucial moment is when the diagnosis is announced. And it was said in the testimonial that often the diagnosis is thrown at the parents without being able to take the time to hear what the parents, what this means to the parents, what they heard about the disease and what they already know about the disease. Even though it is very important to put in the preventative measures from the first consultation, it's more important to feel what the parents are feeling about this announcement, and also the baby who's participating and how he's reacting to what his parents are hearing and what the doctor's saying to his parents. Next slide. What is sickle cell disease? It's a known and feared disease. It's completely unknown often for some of the parents. In African language, it means the cold that grinds the bones. In Bambara, it's a blood disease, it's anemia disease, but it comes as a bomb when the parents, as I said, put together what the doctor said, sickle cell, and what they know from the country that they have left. Their baby, who has been healthy for 1 month, 2 months, 3 months, is no longer healthy. He's now a sick child. He has a serious, incurable chronic disease that will necessitate lifelong care. That this disease is inherited, and due to a blood anomaly is heard by the parents. And the hardest to deal with, and that was said very strongly by Biba, is that he will be subject to intense, painful crises that are unpredictable. And for any parent to see his child in pain and not to be able to do anything about it and feel perhaps that he is responsible needs a psychological accompaniment, so not to be alone with this fear. Next slide. The announcement is painful, brutal, destructive. It creates an irreversible life change. And even if one child has already has sickle cell, as everyone knows, it can be more than one child in the family that has sickle cell disease, but that doesn't mean that the announcement, the diagnosis, is any easier for the parents to hear about. It lends confusion, loss of identity, guilt, and the whole family is affected. If there's other brothers and sisters that are not sick, what does it mean to have a child who's sick? If there's other children that have sickle cell disease, why another baby? And the doctor must find a way to announce this truth to protect the child and the family from any kind of suffering, and to open the road for the future from this very first consultation, that there is a future that maybe he can't do everything that he would like, but this is learning frustration. There's, for all of us, we cannot do everything that we would like to do, but to find a path where the child will be able to have a quality of life that is satisfying for him, for his parents, and for his brothers and sisters. Next slide. And this is, we did a study in France with a pediatrician, Dr. Audievre-Montagnier, about the impact of having a tandem psychological and pediatric accompaniment from the very beginning. And what was interesting was the drawings of some of the children. The drawings are normal, but you can see the psychological repercussions due to the sickle cell disease. And this drawing where the child was asked to draw a woman walking in the rain. And the umbrella there looks exactly like the death sickle, doesn't resemble very much an umbrella. Next slide. They don't come through very well. But you can see that for one child, the body is not grounded. He's floating in space. Another child where there's lack of adequate protection from the rain. He's covered with the rain, but his umbrella doesn't protect him at all. And in the third design, there's many more, but these were caricatures of some of the issues, that his body has no substance. His body is just like a hanger with no hands to protect him from the rain. Next slide. And then the parents are caretakers, and Biba said this very, very poignantly, that the parents must assure the medical responsibility necessary for sickle cell care. Parents don't usually have to have such responsibility every day. They have an overwhelming fear of the crisis and a helplessness in front of these crises. And so this parent relationship, and this is where also psychological accompaniment routine is helpful, because parents can be overprotective because they want to prevent anything bad happening to their child. They can favor excessive dependence on the parents rather than autonomy, which is empowerment. Or they can go the other way and denial of the risks, and sometimes not respecting the medical advice and putting their child in danger. A bit like Decio says in the part, what he wrote, but was not on his video, that not wanting to believe this, and so not giving the medical treatment that is necessary because somehow it's too hard to believe that their child is sick. Next slide. A child with sickle cell disease in France has an average of 1 week of hospitalization per year. This is on the average. This is enormous to me, but nobody likes to have their child in the hospital, and 1 week a year is very much. These hospitalizations mark the children and influence their development. The hospitalizations can be reassuring for the parents because they know the hospital is there and the hospital will take care of their child, but this is not necessarily true for the children. These frequent painful crises are traumatic events. And so psychological support is important for both parents and children, as well as other therapeutic proposals that can be help living with sickle cell disease, as there's medical hypnosis, music therapy, clowns at the hospital, and therapeutic education to have more knowledge about the disease and how to take care and anticipate by the parents. Next slide. In conclusion, the psychologist, my idea of the psychologist is as a translator that puts into words the overwhelming emotions felt by both parents and children. Doesn't necessarily have the answers, cannot bring quality of life, but can be this translator that helps putting into the words. And when these fears and anxieties are expressed in words, this is a liberating process that then facilitates the acceptance of the constraints of living with a chronic disease, sickle cell disease in particular, but any major chronic disease. And then the parents and children are able to construct realistic plans for the future. Not frustration, but realistic plans in relation to their child and his health. And also the psychologist can serve as a link between the traditional culture and practices of the family and the biomedical techniques of the hospital world. So the traditional culture and the traditional medicine is very important for many families that are often reserved and don't want to tell the doctor what they're doing, but this is also very important for accompanying the children, that it's not exclusive, traditional culture and the biomedical techniques of the hospital world. The psychologist encourages autonomy as well as empowerment for the children and for the parents. And as I said, for some children, if there are school difficulties or other difficulties, then can access to more specialized consultations when it's available. And that's the last slide, I think. So thank you. Attention to psychological implications ensures a better quality of life.
Thank you very much,